Good afternoon, everyone. Today, we're here to talk about the new steps we're taking in building a transparent and comprehensive addiction care system in Alberta. Our government is taking bold, swift action to support Albertans struggling with addiction. As you know, the COVID-19 pandemic continues to challenge our community, our province, our country, and in fact, everyone in the world. While our top priority is keeping Albertans safe throughout the pandemic, we must never lose sight of another challenge that continues to impact our families, friends, neighbors in our province, that is addiction. Addiction continues to claim lives and tear families apart each and every day. This is why we remain steadfast in our commitment to build a holistic mental health and addiction care system in Alberta. Prior to a pandemic, our focus on recovery-oriented services was having a positive impact. In fact, we saw an 8.6% decrease in the number of opioid deaths in the first quarter of 2020 compared to the same time of last year. We promised to change things for the better, and we are. We're moving forward with our plans to build a recovery-oriented addiction and mental health care system that extends from prevention, intervention, treatment, and recovery. This is the Alberta model, where we look at addiction as a healthcare issue and put the recovery of our burdens first. I want to be very clear that this government takes opioid crisis very seriously. That is why I'm proud of the solid foundation we have established for the Alberta model, with real solutions to help people recover. Today's announcement, which you'll hear momentarily from Premier, is another way we're working to build a coordinated and comprehensive addiction care system in Alberta. Before he begins, I also want to take the opportunity to say thank you to the thousands of service providers and operators throughout the province who work at clinics, community offices, health center, group homes, residential addiction treatment facility, detox facilities, and more. Thank you for your service to Albertans. We understand in this Christmas season, because of the pandemic and addiction crisis, many Albertans are facing, that you are the ones taking time away from your family to help others. We're grateful for your service and grateful for your sacrifice over the holiday season. Your critical work will save lives. Thank you. Now I'd like to welcome Premier Jason Kenney to come to the podium.
Thank you very much, Jason, Minister Lewan, for those comments and your good work. I'm here today to talk about the significant impact the COVID-19 pandemic continues to have on the lives of many Albertans, particularly the impact on those struggling with addiction. I've often spoken about the unintended consequences of decisions that we've made around public health guidelines to stop the spread and slow the spread of COVID-19. Indeed, those decisions, they weigh heavily on me and everyone around our cabinet table. The public health measures that we have taken are important to protect our hospitals and Albertans who are vulnerable to COVID. And let me pause to say that we know from the 30 deaths reported yesterday and more deaths that will be reported later today by Dr. Hinshaw that the risk is very real and the cost of the pandemic is tragic. There is a very real and often very tragic human cost to COVID restrictions as well. And with many small businesses closing, household incomes dropping, and reduced contact with family, friends, and loved ones, the toll on mental and emotional health has increased significantly. We've seen many reports of increasing increasing evidence of people reporting mental illness, emotional health crises. We've seen it reflected in increased incidents of domestic violence and much more. And we believe that some of that, particularly with respect to the spike in opioid drug overdoses earlier this year, was in part the result of government response to COVID-19 here in Alberta. Early on, as part of our initial series of restrictions, for example, the government suspended the operation of residential treatment centres and then reduced the number of people who could stay within them, and also suspended the operation of opioid dependency clinics. These two measures, we course-corrected on these in April of this year, but these two measures represented a real rupture in the treatment programs for people fighting addiction. And there are many reports that the federal CERB income benefit, while very well intentioned and very helpful to millions of Canadians, had the unintended consequence of significantly increasing the ability of people trapped in addiction to purchase dangerous drugs. For example, Reina Gagnon, an addiction counselor at the Centertown Pharmacy in Ottawa, said that, quotes, "For the majority of my patients, the introduction of the Canada Emergency Response Benefit, which provides $2,000 a month for people who lose their income, has been reckless, and for some it's been deadly." There have been multiple reports. In June, CBC reported that CERB benefits are contributing to a spike in overdoses, outreach workers warn. And it's important for us to learn from these factors that may have driven a significant increase in overdose deaths earlier this year. But it's also why, early in the pandemic, Alberta doubled down on our efforts to provide Albertans with access to life-saving prevention, treatment, and recovery support. We took very early action with the $53 million COVID Mental Health and Addiction Action Plan to increase capacity of our vital and online supports, and also to provide funding to community groups across the province to address the long-term challenges that COVID-19 has created. That was on top of the $140 million new dollars that taxpayers contributed to Alberta's broader mental health and addictions action plan. This is also why we made sure that the restrictions since April and the restrictions currently in place allow for residential addiction treatment providers, mutual support groups like Alcoholics and Narcotics Anonymous, and other in-person programs and services to continue because they reduce harm and they remain open under the current COVID guidelines. I'd like to thank the many faith groups and other facilities that host mutual support groups for the good work that they do right now. Last month, Alberta became the first province in Canada to eliminate fees for publicly funded residential addiction recovery programs, because access to recovery should not depend on the size of your bank account or your paycheck. That's in addition to other many important actions taken, including our $20 million expansion of drug treatment courts, specifically in Red Deer and Medicine Hat. More to come in that regard. Our $25 million capital investment in building 5 new therapeutic communities to provide long-term treatment support for those fighting to exit addiction. The additional 4,000 treatment spaces that we have committed to creating, the expanded access to the virtual opioid dependency program, and as I mentioned, the elimination of fees for publicly funded treatment centers. So I'd like to share with you a note that we received via Facebook recently from a brave young Albertan named Darren, who accessed treatment services in southern Alberta and made the decision to enter recovery during the pandemic. Here's what Darren had to say. Quotes, "It took some time to build the confidence to put this out there, but I couldn't be happier with where I am right now. My life over the last 5 years had become unmanageable with my depression and anxiety, making terrible decisions daily as I had lost all hope, all my passion, and had no goals going forward. I made the best decision of my life to seek help and to get sober. Friday will be my 1 month clean from drugs and alcohol, and I have a ton of clarity with the direction I want to go in my life. I can't stress it enough that if you are struggling mentally, to seek out help as it saved my life. I love you all, unquote. So I know everyone who heard those words joined me in congratulating Darren and wishing him the best on his own journey. This is the positive impact that we are seeing recovery have on people's lives, because recovery works. And that is why Alberta's government has made recovery and wellness the cornerstone of our addictions policy. It's while we are encouraged by stories like Darren's, the latest opioid surveillance data is another serious reminder of how much work remains in helping Albertans access recovery. In July, this is a very sobering statistic that we are releasing today. In July, we lost 142 Albertans to overdoses. However, there are some encouraging trends in these numbers that are cause, we hope, for optimism, because by October, that number of fatalities from overdoses went down by 33%. My heart goes out to everyone who has lost a family member or a friend to the terrible disease of addiction. We've seen that since that peak in July, which was the highest, I gather, highest ever number of overdose-related fatalities on record for a particular month in Alberta. Since that peak, opioid-related EMS responses declined by 36% in October. We also saw record numbers of community naloxone kits distributed in the latter part of 2020, with more than 27,600 kits distributed in the third quarter of this year, which is a record for Alberta. It's an increase of over 5,300 kits from the second quarter, the highest ever in Alberta. I'm cautiously optimistic that we are beginning to see the return to pre-pandemic levels in terms of the opioid overdose crisis. Having said that, opioid addiction has impacted, very sadly, it has impacted Indigenous people in Alberta disproportionately during the pandemic. The rate of opioid overdose deaths amongst First Nations has increased by 61% from 2019 to the first 6 months of 2020, compared to 36% amongst First Nations Albertans. So there is clearly much more that must be done. Which brings me to why we're here today. Today we are unveiling the Alberta Substance Use Surveillance System, an important new online dashboard for substance use data that will help us support addictions recovery. This new online reporting tool, which you can see on the screen beside me, will replace the previous quarterly reports and expand on the data that we report. Now, since opioid poisoning rose to prominence as a major public health crisis around 2016, the harms of other substances have received less profile and less attention. Similarly, when we talk only about opioid-related harms, we perhaps unintentionally neglect other forms of addiction and the harms that they can cause. All addiction, no matter the substance, can tear families apart, destroy livelihoods, ruin lives, and strike at the very heart of our communities. That is why, in addition to data supplied in previous reports, Alberta's substance use surveillance system will expand to include other substances like alcohol, methamphetamine, and other drugs. It will evolve over time to include more comprehensive information regarding the impact of addiction. The online system has several advantages over the previous reporting format that will also better support service providers, program operators, and community leaders in addressing the addiction challenges that we're facing in Alberta. While other jurisdictions like Ontario, BC, and Quebec also publish similar data, the Alberta Substance Use Surveillance System will be by far the most comprehensive in Canada. It features dynamic and interactive data set displays in which users can view information by city, zone, or province-wide, broken down by substance and in many different display options. It provides ongoing and timely updates to validated data, and it is structured to quickly add new data points and reporting metrics as they emerge. To begin, we'll look at the acute substance deaths overview as an example of the data available in this system. So as you can see here, when we look at acute substance fatalities, this data can be broken down by substance, by zone and municipality, and it provides more detailed information about each month rather than the quarterly totals that was available in the previous reports. This data is further broken down in other tabs with zone comparisons and demographics. This slide shows all opioid-related fatalities, which, as I mentioned before, peaked back in July before declining by a third in October, 2 months ago. While there could be several factors impacting this decline in fatalities, one that I can point to is the distribution of naloxone. As I mentioned earlier, we continue to focus on proven interventions like the widespread distribution of naloxone, demonstrated by record numbers in the third quarter of 2020. This data in the new system includes self-reported overdose reversals, the number of kits distributed differentiated by community kits and pharmacies, and a breakdown of zone and registered distribution sites. This provides valuable information about whether further interventions may be necessary. When looking at recovery options, the AHS Opioid Dependency Program patient count, as shown here, it shows us the patient counts over the past 2 years. These programs provide Albertans with evidence-based first-line and second-line medical interventions for opioid addiction. So as you can see, public health measures in the spring did cause patient counts to drop from nearly 900 in January to only 56 in April, a 94% decrease, and there's no doubt that that had a very damaging impact, which we regret. While these clinics have returned to normal operations, they remain below half of their pandemic patient count. This demonstrates an extremely concerning lack of access to treatment during the pandemic. We're working hard to track usage and capacity of the residential treatment centers, as many of them have had to cut their capacity in half during the initial stages of the pandemic and are still recovering because at that time they developed long wait lists. Lastly, I'd like to show one last image in this new system. The impact of addiction goes far beyond the effects of opioid overdose. Here you can see emergency department visits and hospital admission related to alcohol alone. In the third quarter of 2020, we saw 11,500 admissions to hospital due to alcohol use. During the same period, we saw 2,940 admissions due to opioids. That's interesting. This is not in any way to diminish the impact of opioids, but simply to illustrate that the effects of addiction extend far beyond opioids, and the need to look at the full picture of how addiction is impacting our population. With better data collection, the government can make more informed, strategic policy choices about how best to support Albertans seeking recovery. Evidence-based decision-making will ensure that we are providing services when and where they will have the biggest impact. This is one of the many ways we've led the country on comprehensive data and mental health and addiction care. This substance use surveillance system is just the start of our approach to transforming the way that we care for those in our province who are dealing with substance use disorder. So before wrapping up, I'd like to briefly say to anyone who is living with addiction, anyone who has a family member living with addiction, or anyone in recovery from your addiction, your families, your lives, and your struggles are not data to us. Each one of these Albertans admitted to treatment or who enter recovery, each one of these fatalities, each one of these hospital visits represent a family and a community who need support. You can call the addiction helpline at 1-866-332-2322. That's 1-866-332-2322 to get help if you need it. If you're not ready to talk to someone, You can get more information by going to alberta.ca/mental health. Alberta's government, in partnership with our amazing nonprofit and charity partners, will continue to be there for you. We'll continue to increase our support for recovery-oriented care because we know that recovery is real, it is attainable, it is possible. Addiction is a terrible disease, but together we'll build and strengthen a system that gives everyone an equal opportunity to recover, again, because recovery does work. Alberta's government will continue to protect both lives and livelihoods through this pandemic and beyond. Thank you, and I think we're going to then take questions.
Okay, before we go to the phones, I'll remind everyone that we have a lot of callers on the line today, so please limit yourself to one question and be brief. Operator, can you please put through the first caller?
Our first question comes from Aaron Collins of CBC. Your line is open.
Hey, thanks for taking my question today. Just wanted to clarify, there's been a focus on rehabilitation spots, but you're recognizing that it's been difficult to get them open during the pandemic. Since we've seen such a spike in opioid deaths, is there any thought of reopening some of those consumption sites that were closed?
Hi there. Sorry. Yes, they have not been closed. The one that was suspended was Arches in Lethbridge following the audit indicating that $1.6 million had not been, the spending of that had not been properly identified. There were other governance and management complaints and financial complaints emanating from that operation. And obviously, we're not going to continue to fund a place with that kind of track record. We did replace it, however, with close to the homeless shelter in downtown Lethbridge, with a mobile safe consumption operation. And I'm happy to tell you that we've seen since the Arches was closed in Lethbridge, we've actually seen the number of opioid-related overdose deaths decline in that city. I believe it was 7 in August to 2 in September. The other facilities have remained open. We have kept our commitment to Albertans made in the last election to appoint an expert panel and consult broadly with affected communities to assess the socioeconomic impact of these sites on local neighborhoods, which in some cases has been very negative, very devastating for those neighborhoods. So we continue to engage in those reviews, but the policy changes that we think help to drive the increase in opioid-related deaths here in the spring responding to COVID-19 were not related to so-called safe consumption sites. Instead, they were related to the initial suspension of residential treatment of and then the restriction of how many residents could go into them. As you just saw, the number that we went down by 94% in the number of residents in residential treatment. So that was a devastating rupture in early treatment for people who needed that help. Secondly, as indicated, the increased income available to people whose first and last dollar sometimes goes to feed a dangerous addiction through the CERB and other income support programs by many accounts, including from your own media outlet, also helped to drive up the opioid deaths this spring and summer. So happy to take the next question.
Operator, can you please put through the next caller?
Next question comes from Alana Smith of Post Media. Your line is open.
Hi there. My question is for Premier Kenney. I'm just wondering how you can claim that your recovery-focused model is working in a year when Alberta has set a record for opioid overdose deaths 2 months before the year is even complete. And you also said earlier that COVID-19 restrictions were in part related to an increase in overdose deaths. In July, when we saw record numbers, we also had more lax restrictions than we have now. So I'm just wondering how you can equate the two. Thank you.
Well, clearly there was a rupture in treatment, as I've said, that impacted people and drove many who were seeking alternatives including replacement therapy and residential treatment, it drove them, frankly, back to the streets and back to their addictions. We've also very sadly seen a significant spike in the number of Indigenous Albertans who were affected by this increase in opioid-related fatalities earlier this year. And in our discussions with First Nations leaders and people in the field of addiction treatment, we haven't been able to do a full data-based analysis on this yet, but there's a widespread belief that many individuals from those communities left the cities, went back to their original homes, to their reserve communities, and they were unable to access the supports that they might have had in the cities. And so that may have contributed as well, which is to say a shift of population, to, in some cases, to perhaps to places where people didn't have the same level of medical and other support, like replacement programs, naloxone kits, etc. But it's clear as well that the CERB payments, while not a restriction, were a government was a government policy in response to COVID-19, the availability of which, according to people in the addictions field across the country, from Vancouver to Ottawa, was a major contributing factor, because for people who are so trapped by their addictions that their first and last dollar tends to go to purchase additional drugs, it meant consuming a lot more. And that has clearly been a factor as well, as I say, not just in Alberta, but from British Columbia to Ontario. So on your first question, obviously this whole year has been an aberrant year with the pandemic, but we are glad to see that now that residential treatment centres are bringing their clients back in, and they're catching up on their wait lists. With the other interventions that we have made, that we have begun to see a pretty significant decline since the peak in the summer. And while we'll have to wait and see what the data is for the rest of the year, unfortunately, recently introduced restrictions may complicate that fact. But we are glad to see at least a meaningful decline in the number of opioid deaths here. And if you compare the Alberta numbers to British Columbia, where, as you know, they have a more significant challenge, they have not seen the same decline over the past 2 or 3 months since the third quarter.
Operator, can you please put through the next caller?
Our next question comes from Sarah Comedina of Global TV. Your line is open.
Hi, I just wanted to clarify on how the way data is now shared through the Alberta government is going to ultimately help those who are facing these addictions and prevent deaths.
Thank you very much. So, look, obviously, this kind of data is not going to be of immediate relevance to people who are on the street coping with addiction, but it will be enormously helpful to all of the different social service organizations, the treatment centers, people working in addictions counseling, because they'll be able to see it with much more precision, what exactly is going on, what the trends are, which new drugs are emerging as posing a threat, which regions of the province or which neighborhoods in the big cities are being most heavily affected. We'll be able to track all that data much more closely to real time, which will help us to shift resources where necessary to address emerging challenges, to addressing overdose outbreaks, if you will, and trends in local areas or populations. One of the things that we've learned from this data, for example, is that this year we've experienced a particularly serious opioid overdose challenge with our First Nations population. That kind of data is very helpful to First Nations leaders, so they can track that, they can intervene, they can dedicate more resources, they can collaborate with the government and all of the civil society organizations. So an effective response begins with knowing what the problem is, and this is a huge improvement in us being able to identify what the problem is, how it's affecting people, where and when it's affecting people, with not just what drugs, but with other substances as well. So I think this is a very important building block in our broader addiction response.
Operator, can you please put through the next caller?
Our next question comes from Karen Bext of Rebel News. Your line is open.
Hi, it's Kean Bexley with Rebel News. The data released today shows that more Albertans have actually died from overdoses than from the Wuhan virus itself. Lockdowns undoubtedly inflated these numbers, and it seems like it might be at the point where you'd question if the trade-off is really worth it. I mean, on one hand, you're appeasing the mainstream media with flashy lockdowns. They love it. On the other, people are dying in larger numbers than they are from the virus. You keep saying that it weighs heavily on your mind. If it does, will you reverse course?
Sorry, yes. So, Keenan, I've been pointing out from the very beginning that there are negative consequences to restrictions. And this is not a new statement by me or Alberta's government. We've been saying that from the very beginning. The reason we need to take a smart and balanced approach to the COVID response is because COVID is not the only threat to human life in Alberta. It's not the only public health crisis. And both the restrictions I mentioned, the CERB payments, plus the greater stress, economic deprivation, higher levels of poverty, mental and emotional stress, all of those things combined, which are fueled in part by economic and social restrictions, have very real and hurtful consequences. We've never denied that. In fact, to the contrary, we've highlighted that to inform the public discussion in Alberta about the right approach to controlling the COVID virus. Because, as you know, there are some who would have had us go into a hard lockdown in the spring, and basically we've stayed there ever since. That has not been Alberta's approach. Alberta's approach, and we've been widely criticized for this from some quarters, has been to seek to balance all of these different vital interests in our society, including the mental and emotional health of people, including those who are struggling with addiction. When we saw the unintended consequence of those closures of treatment centers and opioid replacement clinics in the spring, we immediately course-corrected and got approval from the chief medical officer to provide an exemption not only for that, but for group meetings, for example, which can be very helpful. And so I think you raise an important question, which is to say that we have lost hundreds of people to drug overdoses this year. At least some of those tragic fatalities were indirectly the result of government-related COVID policies. And we must learn from this. We must avoid those kinds of mistakes as we go forward. Now, in terms of, on the other end of the spectrum, there are those, and I think you're kind of giving expression to this, who believe that we should more or less remove all restrictions that are in place to control the spread of the virus. That, I think, would be also grossly irresponsible. In the last week of October, we had about 100 people in hospital with COVID. 10 days ago, when we decided on the latest rounds of restrictions, we had 650 people in hospital. That's now over 750. As you know, we reported, sadly, 30 COVID-related fatalities just yesterday alone. As Dr. Hinshaw has said, we have lost more lives to COVID than we've lost to the flu influenza in the last decade combined. If we were to, as some would like us, if we were just to lift all of those restrictions and just let the virus rip in the middle of winter in this cold northern climate, where we were in exponential growth just 2 weeks ago, there is very little doubt in my mind from all of the data that I have received and the advice that I've received from public health experts that we would be reaching the maximum capacity of our healthcare system by the end of January. With 750 some COVID patients in hospital right now and over 140 in ICUs, we can manage with those numbers with difficulty, thanks to the brilliant professionalism of our frontline medical staffs, who are increasingly stressed in our large city hospitals. But we could not responsibly cope with exponential growth that would take us from 750 to 1,500 to 3,000 COVID patients. That would blow past the maximum capacity. And that would have doctors deciding on who doesn't get care. That would result in the wholesale cancellation of non-urgent surgeries and hospital medical care in the province. That would create its own health crisis. So I guess I would say to you, Keenan, none of these are easy choices. We have to take all of these factors into account as we try to make the best decisions we can to protect people's lives and their livelihoods.
Okay, we have time for two more. Operator, can you please put through the next caller?
Our next question comes from Graham Thompson of iPolitics. Your line is open.
Premier, I'm really intrigued by your comments about the CERB payments making things worse. Did your province, did the government look at this? How significant is this? And also, like, is there anything a government could do that moving forward we'll probably see more income help from government? How does the government try and protect people from themselves when it comes to giving them money that they're using for drugs?
Those are very good questions. And we did raise this concern with the federal government when we started to get reports from people in the field of treatment, recovery, and addictions. And we made, when I first raised this with some federal ministers, they said they hadn't heard this concern. They weren't aware of it. But you can look this up. CBC has done multiple reports across the country, quoting, I'm just looking for some of these citations, quoting from people in the field of addictions about the impact that additional income undoubtedly had. And this is, I don't think there is an easy answer, Graham. The reality is, I'm told that in the downtown east side of Vancouver, on the day that people's income support checks show up, they pre-position ambulances and additional medical resources because they know that some of that money is regrettably going to turn into drug consumption and overdoses. That is just the reality. So at some level, it's about risk management. You have to provide a basic income to everybody to be able to survive. But I think all governments need to learn from what happened here this year and see how we can better manage income support programs for people struggling with addiction. Because you take somebody who might have been receiving, here in Alberta, $750 a month, I believe, from income support, and you suddenly move that up to $2,000 a month, and that person is more inclined, perhaps, to spend that money on fentanyl or meth than they are on a healthy meal, well, inevitably that's going to lead in a dangerous direction, as we have seen and as we've heard from people working on the front lines with folks coping with addiction. So I as I stand here now, I don't know what the remedy is. We want to treat everybody, regardless of their health condition or their income, their social economic status. We want to treat everybody with dignity. But I guess our response in Alberta is this. We're trying to intervene by providing far greater access to treatment for those individuals so they can get out of that destructive cycle of addiction.
Operator, can you please put through our final caller?
Our final question comes from Charlotte Demelin of Radio-Canada. Your line is open.
Oui, bonjour. Merci de prendre ma question. Monsieur Kenney, peut-être d'abord, ça vous fait quoi de voir que les mesures prises par votre gouvernement pour combattre la pandémie ont eu autant de conséquences sur la crise des opioïdes et à quoi vous vous engagez pour réparer, disons, ce que la pandémie a fait?
Nous nous inquiétons que certaines des politiques envers le COVID-19 a effectivement augmenté le nombre des morts à cause des sous-doses des opioïdes. Cette année, en juillet, on a eu le pire mois dans l'histoire de l'Alberta en ce qui concerne les morts des sous-doses des opioïdes. Alors, c'est une crise de santé publique, juste comme le COVID-19 est une crise de santé publique. Et c'est clair que nos décisions à fermer, par exemple, les centres les centres résidentiels pour les gens avec les addictions en printemps ont vraiment frappé certaines personnes et également que les paiements, le CERB du gouvernement fédéral a augmenté les revenus disponibles pour les gens avec les addictions d'acheter plus des drogues dangereuses. Alors, ces choses-là, ensemble, nous croyons à mener vers cette augmentation épouvantable et tragique. Alors, nous avons au moins, nous suivons de près les résultats de tout ça. On a changé le cours, on a ouvert tous les centres de traitement et les autres programmes. Et nous, comme une province, nous mettons l'accent sur une augmentation des lits disponibles pour le traitement résidentiel pour les gens qui souffrent des addictions dangereuses.
Okay, we'll leave it there for today. Have a nice weekend and a very Merry Christmas.
Yes, everyone, I'm sure I'll do another one of these, but it's the last day of Hanukkah, so let me wish all of our friends in the Jewish community Chag Hanukkah Sameach, Happy Hanukkah, and if I don't do another news conference the next week, Merry Christmas to everyone, and with all of this is a tough time for all of us, especially with all of these restrictions for families at this time of year, but we're going to get through this together and come out stronger on the other side. Thank you very much.